Bill, you've been speaking at an IOSH healthcare group event today about breakaway and restrictive physical intervention. Now, when and how to restrain patients is a contentious topic in healthcare in particular, and there are plenty of examples reported in the press when it goes too far and patients actually die as a result. Why are healthcare professionals getting it wrong?
Well, I don't think they necessarily are. Certainly the majority are not. In fact, those incidents and those tragedies you refer to, devastating, but fortunately rare. So healthcare professionals have to operate in some very challenging environments. And in some of those environments, there's a time when they, for example, mental health and learning disability settings, that they need to restrain people to stop them harming themselves or others in an emergency situation, for an example. And there's risk there. There's certainly an important focus on training. There's a focus on managing to prevent those types of situations occurring in the first place, the preventive side. But sometimes they will still occur. And there will be times when both staff and patients get injured. I don't think everybody's receiving the proper training, and today we've debated what is the proper training. I mean, today with the research from Glamorgan University and from other studies, there's a question as to the actual validity of some of the training, of breakaway skills, for example, which is a very old-fashioned term that explains training to get away from harm, much of which the research is saying, and it's certainly my view as well, is actually a lot of time and money wasted, because we're teaching skills to deal with situations that rarely or never occur. We're not addressing the real risks very often. We're teaching what we think people need. And staff forget those skills. So I think quite rightly they're being challenged. So I think there's some training is very good. Some of it can improve a lot. There definitely needs to be more research, which is what we're hearing today, around the effectiveness of training. And training can make a difference. If people work as a team and know what they're doing, and hopefully training can prevent some of these restraints in the first place. There are times when we certainly need to get patients more involved. There are also times when there's emergency, rather than necessarily planned interventions. There's times when there's an emergency, and staff, coming back to your point about who's accountable, the staff member must account for their actions. I mean, that's within the law. So they need to account for any use of force, whether that force was to get away, to stop an assault, or to hold somebody. They must account first and foremost, and that's why in a serious incident, the police will often be the first group involved. And until that police investigation is done, then no other investigation can follow. Following investigations, of course, may involve the enforcement agencies and, of course, lead to a civil action.
Now, there are lots of jobs that entail very high risks, but do you think healthcare workers need to change their own views on whether suffering violence goes with the job? Can you become too complacent about receiving aggression at work so that you don't take the time to try and manage it better and not put yourself in those situations?
I think in some situations, and it does vary because healthcare is such a diverse area, and I think that in some settings where staff are continually getting pinches and bruises and knocks, and they maybe not intentional. They don't see that as an intentional harm, and particularly if it's involving a patient, and they are not judgmental about it, and they often don't report it because they do see that as well. That is a hazard that goes with the job. I do think, however, that staff within healthcare generally now are less tolerant of the aggression and nasty that can come from relatives and from some patients. I think the tolerance is probably more around where patient maybe isn't fully in control. I think that's where the tolerance is. But there's a long tradition of saying things are part of the job. I think zero tolerance in the campaigns we've seen in the UK, I don't like the term zero tolerance. I don't think it works in a therapeutic context anyway. However, what those campaigns have served to do is help staff to recognise that this shouldn't be happening, it should be happening less, and they don't have to, it's not part of the job.
We've obviously talked about this in a healthcare setting, but this kind of approach to tackling violence, aggression, isn't just limited to healthcare, is it? It's very topical at the moment with the police force, for example.
Yes, yeah. The whole issue around use of force, particularly at the moment, off the back of what we've seen on television with G20 and situations, is about the... also, there's the issues in nightclubs and pubs, the nighttime economy. A lot of people are actually struggling with this, the whole issue around violence, and what organisationally they can do to reduce risk to staff and those, their customers and their patients. What they can do then in the way of training their staff, which today there's been a lot of focus today on training, and particularly the difficult areas such as physical skills. But there's a lot more focus on best practice now, and it's good to see some of the sharing going across sector. I think we see some sharing within the NHS, for example, but now I think there needs to be, and there is some more, but there needs to be more sharing across sector to learn the lessons and find better strategies for dealing with situations. And clearly if a nurse gets assaulted or something like that, or a patient suffers, then that's a story. I think violence is a sexy subject. So I don't think I think we can't do much about that. I think we're going to hear about the nasty incidents. I don't think we're going to hear about progress in the media, but I think in the business publications, if you like, the sector publications, absolutely we want more case studies, more examples of best practice, more evidence-based case studies that show that work-related violence is a complex risk to manage. It's multifaceted, but there's plenty of good case studies out there now in every sector, and I think we need to share that.
Thanks for your time, Bill.
Thank you.